4 years ago, we shared a story of a spark, 9 decades old, that was in need of reigniting. We announced the launch of the most ambitious campaign, b2020, Choose Your Impact, since the formation of Bryan Memorial and Lincoln General Hospitals. Both hospitals were highly dependent upon philanthropy, and both proved to be visionary and transformational. b2020, Choose Your Impact, called on donors to again aspire to help create healing environments, impart knowledge, and enrich lives for years to come. The physical environment of Bryan Health matters. It is where physicians practice, nurses provide care, employees work, and patient trust comes alive every day, one family at a time. b2020's public launch coincided with the opening of the new Bryan Counseling Center and Bryan Independence Center on the Bryan West campus. These enhancements were possible because of Bryan's unrivaled commitment to substance abuse and mental health treatment. Donors knew that Bryan would continue to do what few others throughout the region could even dream to attempt, and understood how vital this need was and continues to be. Thanks to b2020 donors, Bryan now features healing spaces designed for relief, rehabilitation, and rejuvenation. Rehabilitation patients and NICU families, those who typically have the longest inpatient stays, are able to reflect and heal outdoors, warmed by the sun and cooled by the fresh air. And as we meet this evening, private gifts are hard at work. Construction crews work around the clock on one of our largest endeavors to date, the renovation and expansion of the Bryan East campus. The first phases of state-of-the-art surgical suites and enhanced visitor space for physicians, staff, patients, and families will open in early 2020. The final phase should be complete in 2022. Bryan continues to prepare this generation of caregivers and the next in a myriad of ways. Imparting Bryan values, our students are accomplished when they enroll in Bryan College of Health Sciences and prepared for their career when they graduate. b2020 supporters didn't just fund student educational needs. Donors demonstrated a commitment to education both on site and throughout communities in our region, ensuring the lifelong learner opportunities to enhance skills and expertise. One of the most visible and highly leveraged examples of donor dollars at work is Bryan's Stop the Bleed training. More than 7,000 people in the state have been Bryan trained on tourniquet basics to stop the bleed. We've also begun to train the trainers to further expand the impact. Donors who chose this avenue of support have literally saved lives and limbs through their generosity. In the last 4 years, Bryan College of Health Sciences student scholarships have grown, as has the enrollment. Over 200 students receive scholarships. The smallest award is $1,000 per student. The most prestigious are full ride awards. Today, Bryan College of Health Sciences has an enrollment of 775. Our students have the state's highest national exam pass rates. 99% of our graduates pass their licensing exam on their first attempt, and we have essentially 100% job placement rate for graduates. Imparting a passion for lifelong learning has been the choice of many b2020 donors. Employee scholarships and advanced certifications enable our clinical workforce to embrace the newest techniques and latest technology to improve patient care. These donors are making it possible for Bryan to recruit and retain the best and very brightest talent. Going beyond the requisite to find a better way to care has established the Bryan difference and creates a Bryan patient experience. b2020 donors enriched thousands of lives by creating moments of comfort and healing. They enabled more than 30 Bryan nurses to become certified sexual assault nurse examiners, trained to guide adult and pediatric victims through their medical, legal, and emotional issues. Donors also embraced patients seen in Bryan's emergency departments. Whether from injury or emergency treatment, many are left without clothing to wear at time of discharge. Every patient deserves the dignity to leave the hospital warm and clothed, and our donors have seen to it. The Angel Eye streaming camera allows NICU parents, when not at the bedside, to see their baby in real time from their phone, computer, or tablet. Every neonatal intensive care room has this technology to comfort parents who may live across the state, who may be caring for another sibling at home, or may have returned to work. Yes, 4 years ago when we launched b2020, we acknowledged the $40 million goal was ambitious, but within our reach. Tonight, we celebrate those who joined us to boldly reach high.